Good morning, everyone. Welcome to the second Vaccine Equity Coalition call. I know we still have some people joining, but we do have a jam-packed agenda today. The theme for this month, will be hesitancy. So we're going to share some stories about why people are hesitant or may even not have access to the vaccine from our partners. If we have time, open up for other people's thoughts about what they may be hearing so we know what we're up against. We're going to cover the weekly reporting, show you the initial impact, and then answer any questions, and then tee up next month, which is the organizations that are sending texts. What's working? What helps people make a better decision? And we can all learn from each other. So to start, hesitancy. So Posey, if you could share just a quick personal story of something that happened to you recently to tee us off.
Well, it's not even recently, it's today even. My entire family is very pro-vaccine. We're all twice vaccinated. When my kid, 12-year-old son, got his second shot, he actually had adverse reaction and went into the emergency room. So that same night, he had trouble with his heart. And we took him to the emergency room. He was diagnosed with swelling of the heart wall, which is a common side effect. And just this morning, I kid you not, I had a follow-up call from the hospital trying to make sure that we're okay. They were trying to keep us informed of whether this is expected, what to do if a booster shot were to be called, and make sure that we were followed up with a whole bunch of other tests. We're pro-vaccine, but this happened to us. And whenever I tell the story, especially my mom, who is only one shot in, she gets concerned. This is her grandkid, right? And she got worried. She is refusing to take her second shot right now. So even very logical people like me, very logical people are affected by these personal stories because it happened to my son. So I want to share that. I want to make sure that we're in a safe space. We're here to share our stories, and I'm hoping that with sufficient information, that people will make the right choices for their family.
Thank you, Posey. And again, so sorry that you had to go through that. And I have a few other organizations that are going to share what they've been hearing on the ground as well. So Andrea is here from Global Resource Management. We've been partnering with them for 2 years almost. I think they've been working on the border, especially becoming prevalent with Remain in Mexico, one of Trump's policies called MPP, which created these massive refugee camps on our border and in dire need of medical help. And so, Andrea, what are you hearing on the ground there for hesitancy or access?
Well, like you said, our problem is twofold. It's the logistics of the access and delivery, and it's also hesitancy. We had the same concerns when we started implementing testing we were an early COVID tester on the border and had access to that, and people were afraid even to do the test, that somehow we were implanting something in their body. So we see some of those same hesitancies when it comes to the vaccine. Of course, it is much more invasive procedure than the test. However, we have gone through several waves of COVID through our camp populations, both in Matamoros and Reynosa. Matamoros was managed a little bit easier because we had more resources there. People didn't get as sick. So there was more hesitancy there as far as vaccines go. However, in Reynosa, our population was pretty ill. Several people had to be hospitalized, and it really ravaged the population there. So we have more buy-in for the potential of a vaccine program. Some of the logistical issues we face with a transient population is delivering either Moderna or Pfizer is a two-shot protocol. And we often don't have people for 30 days and can't guarantee that second protocol or that second shot. And how do we provide a level of medical education that lets people know that one shot wasn't enough? So we don't know if that is the responsible thing to do, or if it's only aiming towards the Johnson & Johnson, since we can have one shot and go, even though it might not have as much protectiveness against the Delta variant. So while we try to figure out pathways to bringing vaccines into Mexico and delivering to the population, these are some of the questions we are wrestling with. What is best practice medically to get shots in arms? On top of that, it's just all of the regulations of moving things from one country to another. The cold chain supply when you're working outside in a refugee camp, and then how do you allocate those if you have small numbers coming in spread out over a long time? Who are the priority receivers of the vaccine, et cetera. So those are a few of the challenges we are trying to work through in preparation for being able to access vaccines.
And one other question, follow-up, I think you had shared with us before, is there was still a reported incident that at a certain, or I don't know if it was a vaccine or a testing, but it was a place for federales to round up.
Yes.
That's
so
still occurring.
yes.
And you share that part?
Sure. So at our clinic in Matamoros, which has been open for 2 years now, we saw a sharp increase in the number of Haitian asylum seekers coming in over the last few months. And it's gotten to the point where there are literally hundreds of people waiting outside our clinic each morning for us to arrive and start to deliver medical care. This population became targeted in large part because of the color of their skin by both officials and locals. And one morning, our project manager got in, there was an even larger amount of people there. And they were told to come by a local pastor to get a vaccine from us, and then they would be transported to a shelter. We didn't know anything about this, obviously, because we don't have vaccines in country. And then about an hour later, a few buses showed up with federal police, and people were loaded onto the buses to go to a shelter. So we were used in kind of a ruse to load people up on buses. And from what we can tell, they were deported down to Chiapas in southern Mexico.
Thank you for sharing that. I know it's a very frustrating and difficult situation.
Yeah.
And thank you again for all your work.
Thank you for your support.
To Sierra for Freedom for Immigrants. Freedom for Immigrants is dedicated to ending immigrant detention. We have by far the most number of immigrants in the prison system. And Sierra, what are the challenges that inmates have in getting access to the vaccine or even trusting it?
Yeah, so we monitor and document detention conditions through our visitor volunteers who before pandemic would visit with folks. And then we also offer a national hotline where people can call from all of the immigrant detention and jails across the country. So what we're hearing is a lot of concern. People have concern about the vaccine safety. Some folks have underlying medical conditions, and they want to speak with medical professionals who are not as part of the ICE system because they don't trust those sources. We received lots of reports of medical neglect and abuse from folks inside. So there's a lot of mistrust among the information being received. Many folks have already contracted the virus, so I think they're concerned as to why is the vaccine needed if they've already contracted it. And I think mistrust is the deepest reason that we're hearing. And one thing we're trying to do is advocate for third parties to administer the vaccine and for medical professionals from third parties to be able to provide guidance to folks that are interested in receiving the vaccine. It's kind of there's not really a coordinated effort across all facilities. It's managed on a state-by-state basis, and so there's a lot of inequity in that process, and it's often left to the ICE facilities themselves to come out with a rollout plan. So we've heard people are receiving the Johnson & Johnson, but again, it's difficult for people to willingly sign up. I think there's also concern around whether receiving a vaccine will impact their immigration case. So we're trying to fight against misinformation, and when people call the hotline, we're trying to inform them as much as we can. But we ourselves are not medical professionals. Our volunteers who run the hotline are not medical professionals either. So I think it's a balancing act for sure.
So even though ICE, I mean, what's I guess was I wasn't even aware, but if ICE and if anyone wants to chime in with questions, it's you'd think about it as a central uniform organization, but it sounds like every ICE facility is a little different in terms of access and even who administers it, right?
Exactly. Yeah.
Thank you, Sierra, and thank you again for everything for Freedom of Immigrants does. As for everyone's knowledge, the hotline is also made possible by the funding, thanks to Twilio. And thank you again, Sierra. So Thai Community Development Center, or as we like to say, Thai CDC, Chansey, I believe you're on the call. They have a clinic that is, I don't know if it's a weekly clinic that's available, pop-up, as you can see here, where they actually offer vaccines, has been working in the central Los Angeles area for low-income community members to ensure economic and healthy well-being. What are you seeing? Why are people, even though the vaccine is there and available on the street, hesitant to be vaccinated?
Yes, hi there. Yes, we're Thai Community Development Center, not Thai Center for Disease Control, even though it makes sense to be Thai Center for Disease Control in this regard. So yeah, we've been operating clinics since February, and the standing clinic that we're operating here, you see in the photos, is at our East Hollywood Certified Farmers Market in Hollywood on top of the Metro Red Line station. And that's been a standing clinic since April. And it is held in conjunction with our farmers market, which is held every Monday and every Thursday. And our clinics run from 1 to 7 every Monday and every Thursday. In fact, today we have a clinic. And so what we have seen, we serve in that area of East Hollywood, Los Angeles, and the Western Gateway of Thai Town, a very diverse ethnic community, predominantly Armenians, Thais, and Latinx. And we also have unhoused populations in that area. So the hesitancy that we've seen has been among the Armenian community. While we have literature, education materials around myth versus facts when it comes to vaccine in the Armenian language, unfortunately, we can't seem to convince them that the vaccine is safe and is good for their protection. They and it's across all generations of Armenians. They seem to think that they don't need it, they don't trust it, and they don't have the confidence that it will be protecting them in any way. And then among the unhoused population around there, while we administer the Moderna, the Pfizer, we also administer the Johnson & Johnson. And the reason why we have Johnson & Johnson there is because we know there's a significant number of unhoused people in the area. And we thought, that one-shot deal would be so convenient for them. They don't have to, because they're transient, they don't have to come back. But in fact, they just don't want the vaccination. What we have found when communicating with our nurses is that they don't think it's of any use for them, because they feel like they are already out in the open, that they're not going to get the virus or catch the virus, and they have been able to be infection-free up to now, so they don't think that the vaccination will make any difference. We also saw some hesitancy, at least when talking to our nurses, because they had to reassure some of our patients who are pregnant or with children 12 years and older with developmental disabilities, or who are autistic, or women who are nursing, they're not sure if there'll be some adverse effect from the vaccination. So our nurses have had to reassure those members, those patients, that the vaccine will be safe. And so for us, it's all about also equity and access, because we're serving a predominantly limited English proficient population. Having the vaccination clinic there, we were bringing it to the community, and Thais are all pretty much getting vaccinated because now we have the language staff supporting them through the process. And then we also are making it convenient for the Latinx population because they tend to have long work hours. Because we're open in the evening, they're now able to access the clinic.
Thank you, Chancey, for sharing. If there are any other hesitancies that people are hearing, if we could please put them in the chat. We do have to get going with the reporting, because everything you're doing, Chancey, both with information and vaccinations, is being done across this coalition. And together with the steering committee, which thanks to Chancey was also on there, I see Janice from Asylum Seeker Advocacy Project, Tunisia from South Dakota Voices for Peace. We wanted to ensure we were impactful. We have only received half the funding from Twilio, and then we should receive the next half because we are trending quite well. The weekly reporting was created that we could see the impact and surmounting these challenges and make it as quick and easy as possible, because we are all nonprofits. We all know in the development world that impact and monitoring and evaluation is vastly important, but we also have to be able to be there at the farmers markets, sending out texts, writing pamphlets, creating impact reports. This is the result, thanks to Jamal and Posey, who created this. We will start releasing this to everyone through My Camino, so you can actually see this in an individual organization, but this is across the entire coalition. We've reached well over 100,000 people with text, pamphlets, social media, leading to, and again, this is only in 3 weeks, nearly 600 vaccinations. We're tracking partners that are doing self-reported and on-site. We'll make this available to everyone. But in terms of reporting this to our funders, and as we're seeking new funders for this coalition to be able to continue expanding, especially as boosters come into play, this is the result of everybody's work. For the past 3 weeks that we've done the weekly reporting, it has been fairly lenient. There are still a very few organizations that haven't received their funding because of some administrative approvals of fiscal sponsors. By and large, most organizations should now have cash in bank. We will start getting more on top of making sure partners, everyone here, is submitting weekly reports. And with that, we wanted to make sure it was crystal clear, because once you know it, once everyone is entering this on a weekly basis, it should just take a few minutes, but what each of these boxes mean. So I will have Posey run you through that part.
Already. So I hope you know where to find this. If you go to our homepage, it's on the top right-hand corner, partner reports, and there you'll find a link to this page. Each organization is assigned a 6-digit account code. If you don't know what it is, please put your hand up or put it in chat. We'll make sure you know. And for every reporting week, just put a date sometime during that week. We will make sure it is a Monday. Put your email in there so that we know who's submitting it. For any field that's in here, if you don't know what it is, just hover on the title. It'll tell you what we're looking for. I want to specifically say that, hey, if you didn't do any outreach, just put 0 somewhere so we know that it's affirmative 0. We didn't do any email campaigns this week. And same goes for the number of people vaccinated. I think there's some confusion there. If I'm saying that I am directly observing that you were vaccinated, fill it in the, actually, is there a different slide for that? Yeah, so if you're doing this kind of work, fill it in the direct, okay? On-site direct, on-site vaccination. And that's this field over here. Self-reported means you ask them, hey, did you get vaccinated? And they say, yeah, I did, but you didn't actually witness it. So that's self-reported. And self-reported intent is you ask, hey, are you going to get vaccinated? And they say, oh, yeah, I'm going to go next week. So those are the three numbers that we're specifically asking you to break out. So if you have any questions about how we want those three numbers break out, please raise your hand or reach out to us. We'll help you
We
further
still
define.
have some time. So does anybody have any questions now? Because we still have 7 minutes left. Does that help clarify? Are there any open questions about that?
Quiet group today.
Hi, this is Alejandra from Community Health Councils, and our apologies for missing the last meeting. So yes, question, and sorry, I don't have my camera on. My camera is doing something funny. But in terms of the issuing of, text messages and emails and social media postings, we wanted to clarify that all of those count as interactive outreach.
Yes.
Correct? That's how we interpret it, and that's how we've been collecting our data. But we wanted to make sure that really, like any kind of text message that's put out there, email, we are purposely counting those.
That is,
Yeah, go ahead.
I understood that. Well, I have that as correct. That
Yes,
wait,
I
yeah.
was going to say correct.
I just want to make sure if we disagreed on that. I was like, no, you're doing it correctly.
Okay.
Yes, you are.
Okay. That's helpful because, I think that the target number is 14,000, and, we internally, we said we can probably reach that within a couple of weeks, if not months. Right. But we were like, is it 14,000 confirmed contacts where, we're getting the 14,000 people either self-reporting or we can report. But we understood it as the first, what you just indicated. So that was just a point of clarification.
Yeah, and I will also say Twilio and PagerDuty, who were the first and hopefully not the last funders of this coalition, have been really open to learning from this, because right, it's like I received the text, but so what, right? And it's always, if you think about it like marketing, it's always know what is that specific point where somebody makes a decision to do something, whether it's buy a can of Coke or in this case, the very helpful get a shot. And they're trying to figure out like, does it really help for social if we had 1 million social media posts but very low vaccinations? So they're very open to learning, and we're also open to the feedback of getting that. I will say from this coalition, what we promised to the funders of reach, we're blowing it out of the water. The vaccinations will take some time, but we also have, and it'll be difficult, and we'll get into this in future calls. We will start thinking of a quarterly, very quick survey to send via text to a sample group to see if people have made a decision about getting vaccinated as well. I don't see any other questions on chat. Any other questions?
I just wanted to thank Bart and Posey because I had and my staff had gone back and forth with the both of you to get further clarity on the success and intent boxes. And so once we got that clarity, we have started counting correctly. And so, so we're counting those numbers from our outreach efforts because, as you know, at the actual vaccination clinic, we do witness people getting the vaccination. But when we have our COVID relief days and our outreach to restaurant workers and outreach and tabling at our own clinic and any kind of outreach, we will now take down those numbers when we ask those questions. Have they been vaccinated yet? If yes, we didn't witness it, we put it in success, and if they will, we put it in intent. So my staff, they're like,
Should we say something different? Like, is there a better way of saying it?
No, I think you have it correct. It's just I really appreciate that you and Bart were able to provide that clarity. So thank you very much.
You're welcome. And I want to say one other thing, because just on the terms of numbers, it is completely okay to put zeros for week after week, because there are certain organizations like Andrea mentioned that are in a hold pattern, right? That we essentially, in the area where she works, there's the access to the vaccine. So we just want to make sure everyone's remembering, but the 0 is fine because there are certain areas that can't get access to vaccine or information, right? Like think about all the challenges of getting the hotline dialed at at ICE locations. So there's nothing wrong with 0.
Mhm.
Please don't feel bad about like I didn't do it, because we realize everyone is mindful that we're dealing with an access issue. Alejandra, I see
Alejandra.
the question, but I do have to call out one more thing because I know we have one more minute, but we can happily stay later. These are the organizations that we know are sending texts. If you could chat, if you do not see your organization but have sent texts before this coalition, please just say either raise your hand or say hi in the chat. Next week or next month, we want to share stories about text campaigns that worked or failed, probably failed better, because it's like, what have you seen that's working? Is it text to remind people about coming to a farmer's market? Have you sent surveys? Have you asked questions? Have you shared information? That's what we want to focus about next time. If you are here and have sent text and you're not on this list, please just mention something in chat. We will follow up with you over the coming month. Jamal will reach out just to kind of get a better sense, dig in and see what messaging is working. And we also did a focus group, which we will share the results of because we learned quite a few things from that focus group. So with that, thank you everyone for the call. All the best.
Alejandra, we're staying on.
To your, yes, we will stay on, but just for those that have to run, and I will stop the recording at this point. Thank you for everything that you're doing, and Godspeed and all the best. I'm going to end the recording there.